I'm Dr. Rebecca Todd, and I am one of the OBGYN faculty at the University of Kentucky. I practice at our satellite clinic in Moorhead, Kentucky, and I do general gynecology, including hysterectomies, workups for fibroids, abnormal bleeding, pelvic pain. We also do general obstetrics. We do vaginal deliveries, C-sections. We assist the maternal fetal medicine department in taking care of high-risk patients down in Moorhead. One of my special interests is contraception, which is useful for both gynecology and obstetrics. We counsel patients on long-acting reversible contraception, the arm implants, and the intrauterine devices. And we are one of the very few facilities out in Eastern Kentucky that will provide those to patients. I think the University of Kentucky is an excellent facility, organization. They're wonderful to work for. It's great to be an employee here, but they also provide top-of-the-line health care. And especially in Eastern Kentucky, where there aren't a lot of options for patients, I think it's really great that the University of Kentucky is working to expand in that direction. We are one of the actual satellite clinics where we live and work in Moorhead, Kentucky, but I know they have a lot of facilities where they provide telemedicine, where patients can meet with specialists via the TV screen, and we help to facilitate that. I like the patients to feel comfortable and to think that we are working as a partnership. I obviously have medical expertise and training, but there are usually multiple options, multiple avenues we can go down. And so my goal is to really educate the patient and help them to understand what's going on and what their options are, and then to just be there for them and to let them choose the way they want their medical care to proceed, and then to help them through that process. Well, I am one of the faculty members at the College of Medicine with UK. Teaching students and teaching residents is very important to me. I obviously was a student and a resident once, and if we can train good physicians, they will hopefully come back and practice in Eastern Kentucky and provide good quality care for our patients. So I am doing a national program with the Association of Professors in Gynecology and Obstetrics, and my research project is working on the way we evaluate our students and how we provide them with feedback to help them become better doctors. I like having the experience. I try to offer my patients both what the literature says, but then if they ask, to say, well, in my experience, this is what happened to me. Out in Eastern Kentucky, people rely heavily on kind of support and comments from their family. So things that happen to their mom, to their grandma, to their aunt, to their cousin, those personal anecdotes, those personal experiences are very important to them. So being able to relate to me as a woman, as a physician, and tell them my experiences, it helps us to work better together and to have a better trust relationship.